friends. At the outset, I would like to thank the ARC for this kind invite to be a part of this prestigious meet. Unfortunately, due to pressing commitments back home, I am not able to be present in person for this meeting. The topic given to me is the importance of logbook. As Benjamin Franklin has said, "Tell me and I forget. Teach me and I remember. But involve me and I learn. And this learning is for life." And that's the key for a professional development as well as accountability in our job. So what is a logbook? A logbook is like any other book which captures all that we want to pour into it. So we need to have a specific purpose for which we are capturing this logbook. The logbook for different people will have different importance. It could be the security person at the entrance of the hospital maintaining a logbook of the people coming in and out. Or it could be the housekeeping person keeping a logbook of the date and time of what the cleaning manuals and the cleaning protocols that he or she does in the specific area. Similarly, for a doctor, it could be a logbook of the patients that he or she has seen, treated or operated upon. And this can be preserved either in a paper form or a digital form. So through this presentation, we'll try and see the importance of maintaining a logbook, what are the benefits for the residents and fellows in particular, and also please see some of the best practices in an effective logbook management. So now, the importance of a logbook can be from the statutory point of view as well as from an individual point of view. From the statutory point of view, obviously documentation of the training is important, especially when a resident commits or a fellow commits to a few years of his life to a particular training program. It is but expected that at the end of it, both the parties benefit out of it. The resident from having had a skill upgrade as well as the institute having a trained person help them in the day-to-day activities of the organization. So you could record all the procedures and the experiences time-wise, and over a period of time, this can actually serve as a way to track the progress that he or she has benefited in the system. It also brings about a sense of accountability, so that each institute which has its own protocols and do's and don'ts, this would in a way help in monitoring that one adheres to the protocols of the organization, and in turn would help in the assessment of the individual. As I said, there could be institutional requirements, especially if this program is conducted as a part of a university or the DNB or any other accredited bodies. They would like to, at the end, monitor the uniformity of training across all the centers and across all the individuals or the candidates. And that's why there is a regulatory requirement of the maintaining of logbooks. But more importantly, it also helps your mentor, your faculty to monitor your progress as well as judge you as against the standard, the minimum requirement standard in the system. And each institute also at the end of the term also has the best outgoing resident or a fellow, and this would be a very important document to grade this person's performance. And this is something which can be quantified rather than being a very subjective assessment of what I feel or what somebody else feels about a particular individual. So one of the best practices of maintaining a logbook would be to have regular updates, and this is something which is very easy to say but very difficult to adhere to. Ideally, it is best to have these inputs done as and when you see the patient. So you see something very unique in a particular case and in a particular person, it's best to jot it down at that moment itself, because if you end up in a typical OPD seeing about 50 to 60 or even 100 patients, it's very difficult to remember what exactly was that particular clinching point in a particular patient, the slit lamp finding or a fundus finding, or the history, something that made you think differently out of the box. So if you are able to capture that in your day-to-day practice while you are on the job, that's the most ideal, and that's why we encourage our residents to always carry a notebook. So they can just scribble it in between when the next patient comes in. They can always update it at the end of the day with more details. So if that is not possible, then at least weekly there needs to be an update into the logbook, because as I said, you might think that you remember this for life, but when you see a number of patients on a daily, weekly or monthly basis, you tend to forget that particular standout feature of a particular patient which made an impression for you. And it's always better to, when you record the complete details of the patients, including the dates, the patient's identification in terms of the medical records where you can trace back, and also what was done for that patient in terms of procedures, investigations, or the surgery. And there are apps and technologies which help you in capturing these, but you need not need a very sophisticated software. I think a simple notebook or your laptop is all that is required for these updates. So, as I said, like in everything, you need to make time for these things. There is only so much that you can do within a 24 hours, in addition to maintaining all the requirements, statutory requirements of the organization, your mentor, and having time for yourself. There is a difficulty in doing this balancing act of maintaining the logbook, and generally logbook tends to take the backseat because you have other commitments where timelines have to be there too. But if you are able to juggle your time slots and get time for these logbook entries, there's nothing like it. And if you can maintain this consistently, not just during your 3 years of residency or 4 years, but even later on in your practice, that would be the most ideal outcome. And obviously what it does require is how you do your time management, how you do your multitasking, so that you give equal importance to all the work that you do within the 24-hour time slot. And so I'll just show you a couple of examples. What we see at the end of fellowship program when we ask our fellows or the residents to submit their logbook. This is typically how they would maintain it in terms of the patient demographics, the diagnosis, what surgery was done. This is the surgery logbook. And then during the fellowships, they are given initially steps to do, and then in a graded manner, they might even do individual independent cases for the free patients or so on. So they are expected to, it's not a surgical note, because a surgery note doesn't tell you anything. You can just say that vitrectomy was done, PVD was induced, oil was put, and the laser was done. There's no learning here, because that's what anyone can capture that. But if you can document what you had, the problems, or what was something very standout in that particular case, as well as if you're lucky enough to have your mentor on the side too, and if he or she is able to guide you in terms of your handling of the tissues, your handling of the instruments, your thought processes, how you maneuver your light pipe, the forces, the chandelier, the various armamentarium that you have during the surgery. I'm talking really from a posterior segment surgery point of view, but it could be for any surgery. When you're doing a phaco, how your settings of the machine, the entry that you make, the instruments that you use for your taking care of the nucleus, how you protect the posterior capsule, the endothelium, or in a glaucoma surgery is the identifying the Schlenz canal and doing all the kind of procedures that are done. So if you are able to identify each particular case, that one particular little learning is what this logbook would capture, and we encourage the residents to get this countersigned by their mentor with whom they are posted for that particular week or a month or that OT. So this way the mentor also can give additional points, what he or she feels were the learnings or what were the shortcomings of the individual. A more detailed could be this kind of logbook where you actually also have the pictorial representation. So what was the pre-operative fundus diagram, and if there was an ultrasound or any other investigative modality that was used. And then the intraoperative actual drawing of what was done. And as I said, this is then signed off both by the resident as well as by the consultant. So in addition to the actual steps, it also highlights what are the learning points from that particular things. And I cannot overemphasize this importance of the learning that a person will get from this. I sometimes refer to my logbooks, which I have done way back in the 97, 98 period. And it did help me, especially when you are kind of stuck in a particular case, especially if you are in a private practice. And there's not much that you can fall back on intraoperatively. So at the end of the surgery, you can always, go back to something that was done earlier. Or in anticipation of a difficult case, if you actually go back to your logbooks and try and see what was done, and in the cases where you have done individually or where you have assisted, it can give you clues and steps in which you can probably better prepare for the expected intraoperative difficulties in a case. As I said, this also can be maintained in the logbook in the digital form. So it makes it a little more elegant and you can, in addition to actually writing down what are the difficulties, you can actually, especially if the case had an intraoperative event, like in this case, you can see very clearly the lens touch that happened. So while doing an aggressive base excision in a picky patient, unfortunately this resident ended up creating a lens touch, thus necessitating an additional procedure, that's a cataract surgery. This could be done in the sitting of the subsequent sitting, that's the other point. But the learning from this case, like being over aggressive in doing a base excision, especially in the opposite quadrant, 180 degree apart, is where you're most likely to end up with this kind of. So you have to be very aware of the case that you're doing. What's the eye in total? You're not really looking only at the retina or the optic nerve, but you're looking at the eye in holes. What's happening in the conjunctiva, the sclera, the cornea, the lens, the angles, everything needs to be. So these are the kind of learnings which can also be stored very elegantly, and for you to go back and revisit them, so that it actually helps you in improvising your skill sets. So in conclusion, as I said, maintaining a logbook in addition to a year or every few years, and how you have achieved better results both for the patients as well as for your own clinical development. And it's very important part of the professional growth of an individual. So I'd encourage everyone to very proactively maintain a logbook, and more importantly, get it vetted by your mentor or the faculty, so that whatever you have learned in that particular case, be it in the OPD or the surgery, is also countersigned by them and with additional inputs from them. So once again, thank you for this kind invite.
Very excellent talk indeed, and I thank Dr. Girish Rao, though he's not here, but our thanks to Dr. Girish Rao for that.